Right. Thank you. Let's see. Do I press
You just have to use
this?
You can use that if that works, or just use this. Yeah.
Okay. Thanks for having me. My name is Jeanna Ryan. This is our team here, and I'll be presenting a secondary data analysis on sleep and postpartum weight retention. Okay, so pregnancy and postpartum are vulnerable periods for excessive weight gain. Weight gain increases body mass index or BMI and fat mass, and weight not lost after having a baby or postpartum weight retention is common. So 75% of moms have postpartum weight retention. And postpartum weight retention increases metabolic consequences such as gestational diabetes and then later in life chronic diseases. So even if mom has a healthy BMI, excessive weight retention increases risk of her second child having a BMI at or greater than the 95th percentile at age 4 to 5. That's important. We know what does sleep have to do with this, right? But there is a well-established association between short sleep duration and obesity in the general population. Sleep duration is common after having a baby. The majority of studies investigating sleep during the postpartum period have used self-reported sleep, sleep over 24 hours, and absolute cutoffs for postpartum weight retention. So we looked at actigraphy-derived sleep duration, sleep at night, and a relative cutoff for postpartum weight retention. Now, we took data that had already been collected from a prospective cohort study originally designed for pelvic floor outcomes. Participants were healthy first-time mothers pregnant with one baby. They were enrolled in their third trimester, and pre-pregnancy weight was self-reported at that time, and gestational weight gain was calculated from the weight taken at delivery. Self-reported sleep duration came from the Pittsburgh Sleep Quality Index questionnaire, and objective sleep duration came from actigraphy, which was obtained around 6 months postpartum. Self-reported or postpartum weight retention was calculated with weight measured at 1 year postpartum, and breastfeeding and work status information were collected. Our DAG identified a minimal sufficient adjustment set of gestational weight gain, pre-pregnancy BMI, and breastfeeding. We performed log binomial regression analysis with a dichotomous outcome of 7% or more pre-pregnancy weight being excessive. And then we also did linear regression to assess postpartum weight retention as a continuous outcome. We had 467 participants and a power of 80%. Average age was about 30 years. And the majority of participants reported non-Hispanic ethnicity, were white, and most had at least some college education. Average postpartum weight retention of the total study population was 3.2 pounds. Participants with excessive postpartum weight retention were more likely to have a higher pre-pregnancy BMI, a higher BMI at 1 year postpartum, and then have more gestational weight gain, and to also not be breastfeeding at 1 year postpartum. So there's no differences in sleep duration by actigraphy or self-report between groups, regardless of whether sleep was obtained by and whether participants had excessive postpartum weight retention or not. Sleep duration by actigraphy or self-report was not associated with increased risk of excessive postpartum weight retention in all of our models. And to better understand these findings and limitations, future directions could address sleep duration and postpartum weight retention over different times and time points. Consider sleep measurement as in, is it self-reported versus objective, collected over 24 hours versus only at night. Additional potential adjustment variables, as this was a secondary analysis, we had some limitations, and then other aspects of sleep and sleep dimensions beyond sleep duration, and then more generalizable and diverse populations. That's it.
Yeah. She'll be at the poster session also to answer any other questions. Thank you very much.